This conference will now be recorded.
Hello, everybody. My name is Ryan Bahan, and I'm the Executive Director of Community Living Supports with EngAGE Communities. I'm incredibly excited to be here today to talk about some of my experiences and our organization's experiences in supporting individuals living with diverse ability to have independent housing, maybe for the first time and hopefully forever.
And I'm Robby Spring. I'm very excited to be here speaking with you, Ryan. And I am a senior trade advisor for health and life sciences at the Danish Trade Council in Toronto at the Danish consulate. I help bring Danish health and life sciences companies here to Canada. And that is actually how I met Ryan, Alan, and Bill through EngAGE. They've had the pleasure of coming to Denmark with me and seeing different housing options in Denmark. And as a result, I've been able to share my experience as a sister of an individual with autism, my brother Joey, and kind of be able to discuss the shared challenges that they face as a provider and that I face as a family member.
Excellent. So, Robby, as we've been talking, can you tell me more about what your brother and family would be looking for in a housing option?
It's a good question because what we would be looking for doesn't necessarily exist. We want to be able to have autonomy. We want to have control over where he lives, and we really want to make sure that his needs are being met in terms of safety, security, health, programming, and keeping him happy. And I have to say that my brother and I are so lucky. We have the best parents in the world who have dedicated everything to him. But obviously, as they age, it's not going to be sustainable long term. And so, how do we give him that quality of life without compromising anything for him and giving him a bit more independence? So that's where we're sitting right now.
It's amazing, and I love to hear that because so as an organization, EngAGE Communities, our goal and what we've been facilitating or trying to create, I guess, for individuals is that opportunity to have person-centered, person-directed living where they really are in control. You mentioned autonomy. So there's the 7 domains of well-being that we focus on. That is at the heart of what we do for everybody we have the opportunity to serve. So really, we're looking at people's opportunity to experience and exercise autonomy, to experience joy, to have the opportunity for growth, so to continue growing. You know, we like to say that you can never separate human life from human growth. So it's a never-ending process. What we want at 15, 30, 55, and 99 is probably not the same. So we need to be able to be agile and meet those needs of an individual. And meaning is huge for us. I heard you talk about that as well. And to ensure that people have an opportunity to experience daily moments of pleasure and life passions that are meaningful to them. Identity is another one. We really want to know who the individual is. So housing is so much more than bricks and mortar. It really is about the individual and their support needs, but what do they want? Who do they want to be and who are they? And maybe even helping them to identify that identity for the first time. Security. Sorry, go ahead.
Oh yeah, no, it's super important. I think like making that sense of individuality and making sure that they have that. And you know, when we spoke prior to the panel, I mentioned Maslow's hierarchy of needs, whereas you know, often individuals with diverse abilities don't have the ability to kind of climb up that pyramid. So because first their basic needs need to be met before their esteem needs and then their self-actualization and fulfillment. And so from the individual perspective, I would hope that they don't have to worry about those basic needs being met. And at EngAGE, it sounds like they don't have to worry about those things, which is like absolutely wonderful, which allows them to kind of climb up and be able to focus on their individuality.
Absolutely, and so we do have some measures in place to ensure that we meet those needs, such as care plans, as well as person-centered comprehensive care plans. So they go beyond the personal care needs. Our view is when you move into supportive housing environment, yes, you're there maybe because you need some support and you cannot live independently as you may want to or completely on your own, but that shouldn't be what defines you as a person. I know I'd mentioned to you before, when we first met, the first thing I didn't say about my day is, oh, I woke up today, I had a shower, took some vitamins, and then I ate breakfast. Those are things that should be standard and what each of us should have the opportunity to experience. But then what else do we do in the day? What else is important to us? What are our dreams, ambitions, goals? And those are the things that we really want to continue to build on and continue to focus on.
And of course, and as like a sister, I would hope that one day when my brother is living independently, he'll have the opportunity to explore those things in a safe environment.
For sure. The other thing that you and I really spoke about was how words make worlds. So what we call something. As a family member, I'm really curious, what do you believe in terms of identifying programs versus daily living meaningful experience?
It's a good question. I think it depends on the person with the diverse abilities, and we spoke about this as well. Everyone is so different, and so every person that's coming into EngAGE, every friend or family friend of my brother, they're all so different, and so some of them might need to be told what programming they need to be doing because they don't have the ability to choose themselves, but they know they need to keep busy. Whereas some people are able to express those individual needs. And so an environment that allows that flexibility in terms of supporting people who need to be told what to do and need to be programmed versus those who want to explore their own needs and passions.
Excellent. So again, another common theme of one size does not fit all.
No. And we spoke about that too with respect to funding models as well, and that, you know, a lot of the government funding or any funding is for disabilities in general and not necessarily for the individual. And there's so many different aspects of needs for each person, and it's not a one size fits all.
Absolutely. I know within the province of Saskatchewan, we do have standardized funding, which is phenomenal. It's great. But you know, is it enough? I know on average, individuals that we support, after all their bills, rent, basic needs are met, they have around $265 a month to spend on, you know, we've talked about your leisure experiences and maybe new clothes, things that you find meaningful to you. I think as we move into the future, that's something we really need to focus on as a community, as a society, to increase that funding.
Yeah, and not even just the funding, but increase opportunities for employment. And so allowing them to have jobs that fit their unique skill set so they can earn money and have disposable income like any of us do with our own careers.
Absolutely. And I mean, now that you've mentioned that, it brings another thought to mind. Within our province, individuals who are on what's called the Saskatchewan Assured Income for People with Disabilities, they can earn up to $6,000. And after they earn $6,000, they start to actually lose money from their benefit.
Which is similar to ODSP in Ontario here as well. So it actually sometimes it would make it not worth it to that person to work because it might not be financially viable for them. Or
absolutely.
Yeah.
Right, and that goal, we've talked about growth. So to continue to strive to aspire for more, the funding model somewhat stifles that opportunity.
I totally agree. And then, you know, there's other limitations with funding models. For example, the RDSP, so the Disability Retirement Fund. Those who have it are limited in how they can use it. They have to wait till retirement. But if they've amassed some savings and want to put it towards their own housing independently, they're not able to do that. So, for example, if something my family wanted to explore was pooling together that RDSP between multiple family members and getting a place that was under our family's control, we would be able to do that with the RDSP, even though they already have savings and would be able to have the down payment. And so how funds are allocated and those restrictions placed on those who are receiving the funds can be quite limiting.
Yet we've both said independence and autonomy are crucial to everything that we want to accomplish. So definitely more work for all of us to do to actually experience and have the opportunity to, as I said, exercise some autonomy.
Exactly. Yeah. That's definitely the number one thing. So I think, like, also, I guess, if from the family perspective, so as a sister, and I know from my parents' perspective, what we want for my brother one day would be somewhere that's safe, somewhere that he would feel at home and feel taken care of. We would want some control over the housing situation to make sure that we have a seat at the table, ideally choices over roommates or housemates. And, you know, something that we've spoken about is that sometimes with government funding, that means that the options to those who have diverse abilities are really limited, and they're often mixed in with other individuals who are on probation in low income areas that might take advantage of this vulnerable population. And so someone like my brother, who is the sweetest, most innocent person in the world, would be extremely vulnerable to being taken advantage of. And so having that choice over what area he lives in, who he lives with, is so crucial because it's crucial to his everyday safety.
Right. So I'm actually excited to let you know in Saskatchewan here, we as an organization had the opportunity to work with government and families. So about a year ago now, there were 8 families that they've known each other. Their sons and daughters have known each other for, well, before high school, even into elementary school. And now they're all in their 20s, and we're looking to move out for the first time and live independently. And we had the opportunity to sit down with them and put together what we called a negotiated request for proposal. So we put forward what we as an organization wanted to see and wanted to offer. And the families, with assistance of the government, chose us to build that dream together, to create that vision together. And we actually just opened December 1st of 2020, and all the individuals are living together. It has been amazing. We've got individuals taking turns cooking supper for each other. They've built a shower schedule. So we've talked about personal care needs. So they've got a shower schedule. They're looking after groceries, transportation, ensuring each other are getting up to go to work in the morning. So it's like this built-in care partner team. So that's another word that we use for care partners versus caregivers. We all believe that we have the ability to give and receive care. And that's all of us. That's including the individuals that live there, the support and the staff that work there, myself, you. We're all care partners in ensuring that those domains of well-being and the hierarchy of needs are all met.
Yeah, and just to reiterate, that program's called Real Roommate, right?
Yes, yeah. So it's the Real Roommates program.
Yeah, I had heard about that from other individuals at EngAGE, and I thought that was such an innovative model and something unique that they were able to choose EngAGE as the provider, that the roommates were able to choose each other and the families all knew each other, which provides that autonomy, like we talked about, independence, that comfort, that like you know who you're living with and that they're comfortable with each other. And really that first experience outside of their parents' home is familiar, it's comfortable, it's supportive, and that's extremely rare. I haven't heard of that very often here. And it's certainly something that would make my family more comfortable if we were able to pursue a program like that or build something like that. The other thing is we talked about sustainability. And so one model that wasn't pursued, but that was explored, was actually having a space to rent out to a healthcare worker, someone who could help around the house, but also that rent would go towards building a fund for the roommates and for the housing. And I think talking about the future, exploring different sustainable models, so you don't have to worry about funds and external sources of funding or charities, is so important.
Absolutely, and it's really about being creative and where those funds go. Again, as an organization, I think some people assume that those funds would go back to the organization. Really, the intent was that those funds would go to the individuals they're the real roommates. They're the ones that are living there. It is their home, not our home. So another thing that we always try to ensure all of our care partners understand is we have the ability to work and support people in their home. They do not live at our work. And that's a huge paradigm shift, I think, for a lot of individuals who are living in a supportive care environment, that they may feel like they live at someone's workplace. And that's something we have to completely dispel. No, this is their home. You have the opportunity to come and support an individual in their home. And that's when I say words make worlds. When you really start to say that, who's the owner? Who has the autonomy? Who gets to make the decisions? The individual whose house it is.
100%. And you know, it takes away the word or the feeling of it being an institution, or because you don't want to feel like you're putting your family member in that. Like, you want to build a home and create a home, and you want it, as you said, to be their home, and those words, but also creating that environment is important. I think, you know, that ties into my experience working for the Danish government, because Denmark's so strong in housing and so strong in senior housing specifically, in making the environment feel like home and not an institution, and making it more apartment-like and having outdoor spaces. And part of this, Nord Architects is speaking in a panel and talking about their innovative design for healthy aging and for dementia. But that also applies for those with diversabilities. Like, how do you build and make it feel like home? How do you make sure that they don't feel like they're living in an institution? And also in Denmark, the difference is, you know, the state automatically covers everything for those who don't work, so they don't have to worry about funding and having enough funds in the same way that someone here might have to, because that social welfare model is more encompassing.
Right, and I really, just to key on some of the things you had said, when I think about words, when you mentioned institution, you said we don't want to put someone in an institution. But when we talk about a home, you want to move into a home. So absolutely, that's one thing I love about the language that we choose. And I think moving forward, let's talk about that. Moving forward, what do we need to do to ensure that everything you and I are talking about right now, for your brother, for every family member, for any person that we have the opportunity to support, what do we need to change? What do we need to look for?
We need innovation. I mean, we talk about innovation, and certainly in my job, I talk about innovation in healthcare, but there are so many innovative housing models, and I don't think I've even scratched the surface. And we need to innovate in the space, find sustainable environments, create homes for these individuals, and really create places that they can thrive. In that when they leave the home, and leave their parents, it's not, you know, the start of something depressing, but start something more independent and the start of them exploring their needs and self-fulfillment. And certainly what I would hope to see in the future in the space would be sustainable models to give families and individuals more autonomy to meet their needs and have a happy life.
Absolutely. And I know we had mentioned before, if you always did what you've always done, you'll always get what you always got. So definitely speaks to innovation, how we can move forward. And I know we've spoke about the Real Roommates project and how exciting it has been. It has definitely come with some challenges. And our learning is really collaborating with families and with government stakeholders, or any stakeholder for that matter, as well as just transparency and what is going on in the day-to-day. So yeah, it's great to say, hey, it was amazing, but there has been, and still there are challenges right now that, you know, it is not perfect, but with innovation, I think we have to be easy on ourselves and understanding of one another, that we're working towards something new. So as we continue to strive for the next innovation, the next best thing, the next home, the next home for an individual, we really have to love one another and be patient and kind. And I think we'll definitely get there.
I hope so. Yeah, that's the ultimate goal. So more conversations like this will help us get there for sure.
Absolutely. Hopefully this is the start or the middle, certainly not the end.
Exactly. Well, it was a pleasure speaking today.
Absolutely. I've had a ton of fun. I hope everybody else has found it as exciting as I have.
And then you can contact us if you have any questions.
Absolutely. Thanks, everybody.
Thanks.